I'm Louise Campbell, Vice President of Lionsgate Hospital Foundation, the fundraising arm of the hospital and all publicly funded healthcare facilities and services across the North Shore. The foundation will launch a fundraising campaign to improve emergency care for people dealing with acute mental health issues. While we were talking to psychiatrists, social workers, and mental health nurses about the campaign, we kept hearing about the growing number of people in our community who are dealing with mental health struggles as a result of the COVID pandemic. I'd like to share with you a recent chat I had with Linda Latham, the manager of the older adult mental health team on the North Shore. I hope you find it informative. Hi Linda, thank you for joining us today. We've removed our masks, we're sitting at a safe physical distance, and we're sitting in the beautiful Hope Center for Mental Health, which actually doesn't feel like a mental health facility at all.
We're so lucky to have this facility. It's been open now since 2015, and I think all of us every day come to work and we say, what a wonderful place to come to work. And it's been so good for our clients to have all the natural light.
Tell us about the work that you and your older adult mental health team do here at the Hope Center and in the community.
Well, the older adult mental health team is a specialist consulting team comprised of an interprofessional team. We have 4 psychogeriatric psychiatrists, and we offer services both in the community and to our long-term care facilities on the North Shore. Basically, the team does psychiatric assessments and plans treatment for our older age population. And basically, the group that we're really interested in working with is, or that our mandate is for, is the older adults who have mental illness and are showing some cognitive decline. Now, mental illness can onset, as you know, fairly early in life, and so people carry on with their mental illnesses into their old age. It can also happen in old age. We also do a lot of education. My team is always out in the community talking to places like home health because they come in to help our clients and sometimes aren't quite sure how to manage. And we also interact a lot with the teams here and the beautiful Hope Center because our patients do get admitted to the 4th floor, which is where our inpatient unit is.
Today we're talking about dealing with loneliness and depression during the pandemic, and it's a topic that is particularly important as our social distancing measures are more restrictive. Linda, I think there's a general understanding about loneliness, but talk to us about depression. What is it, and how does it feel?
Yeah, most people think that depression is largely a mental manifestation, but actually, if there's ever a mind-body connection, it's with depression, because usually what happens is people don't eat or they eat too much, they don't sleep or they sleep too much, they feel very, very low energy, they have no joy in their lives, things that used to be pleasurable for them stop being pleasurable, they have bad memories, they're very forgetful, they may be quite irritable sometimes too. So it's like the whole way of being is disrupted with depression. There's still some stigma attached to it, and there's also, I think people just don't have an awareness of what a mental health illness like depression feels like. Both of them are caused by an imbalance of chemicals in our brain. We have things called neuroreceptors in our brains that produce what we call the happy hormones. And when people are under stress, oftentimes other chemicals in our bodies decrease the amount of our feel-good hormones, and then we feel depressed. We have many treatments that we can work with people to get those feel-good hormones back again, but we can't treat you if you don't come.
If someone does end up spiraling and experiencing the symptoms that you mentioned before, Where do they go for help?
Well, the first and most important thing is come. We can help, okay? And secondly, I think it's, like we have teams that will try to understand what is the thing in your life that you miss the most, okay? What is your goal? Why did you come? What would you like to see different? And so we'll work with you to set some goals around, how you can start to feel better. And we do have a really good tool chest of treatments that we can use. Most people think that it's all around medication, but there are two other things that we use in conjunction, or sometimes only use if it's mild to moderate depression, and that's exercise and cognitive behavioral therapy. And we'll have to use some trial and error. It's going to take us a little time to figure out what works for you. But if you stick with the program, most people start to feel well. It doesn't happen overnight. The first things we notice oftentimes is that people start to sleep better, which is a really important thing. Then their appetites sort of normalize out. And so it's really a journey, okay? What I usually say to people is, and this is again from my experience, you didn't get depressed overnight, okay? It was a downward trajectory. And so we're going to have to take time to get you back to where you were, and so that you feel like yourself. And often people talk about depression as they don't feel like themselves. They're not me, okay? But they don't know what's the matter. And that's what it feels like. Well, in my experience, general practitioners are usually very skilled at dealing with anxiety and depression. And we often will not, if we saw everybody who was anxious and depressed, our services would be overrun. It is being managed very, very well in primary care for the most part. So I think general practitioners are really good at helping initially with things like anxiety and depression. I've had really good experiences working, in mental health, where the GPs, if they run into difficulty, that's when they will make a referral to one of our specialist teams.
You mentioned cognitive behavioral therapy, and we're hearing more and more about that. How does it work?
So one of the things, this is an area that has received a lot of research, and we know that there is a connection between how you think, how you feel, and how you then behave. So cognitive behavioral therapy is a therapy that looks at, the connections, like how are you thinking that may be pulling your spirits down. And typically what happens is that oftentimes people become very down on themselves. Depression has, in past, people would say, well, just pull up your socks, have a stiff upper lip, that kind of thing. And they feel ashamed and embarrassed that they are not functioning the way that they should. And then they begin to start saying, I'm really useless, I'm disappointing my family. And that is where we intervene with cognitive behavioral therapy to try and change the way you think. And it's a very powerful tool. Again, changing negative thinking, one of the ways I often explain it to people is that I say, your brain is like Teflon for positive feelings and like Velcro for negative feelings, okay? So we've got to smooth out the Velcro and get rid of some of your negative thinking. And it's going to take time and practice, but the more you do it, the more you will be able to interrupt that sense of I'm worthless, I'm useless, and start challenging those thoughts. And that's exactly what the treatment is all about. There's many techniques that we use, but oftentimes we will challenge you, say, is it the truth that you're really useless? What have you done today? You know, and oftentimes when we start challenging thinking, people can then reframe how they think.
Some of us don't have a family doctor or GP. What do we do then? Do we go to a walk-in clinic for help?
And we have good resources here on the North Shore. We have our urgent and primary care clinic that just opened last year down on the Esplanade. We have Health Connections, which is on St. George and 15th, again for people that do not have GPs. And in a worst case scenario, if what you usually do is to go to a walk-in clinic, then go to the walk-in clinic and be directive and say, I've felt down for a long time, I need to be referred to a mental health team.
If we see a friend or family member struggling with loneliness or depression, what can we do to help them?
A lot of people, just as a lot of people don't know how to get help for depression, a lot of people don't know how to help others. For me, I always come from a place of compassion and try and sort of get into their shoes and think about what it must feel like and to try and verbalize that. And people may not want to talk right away. So it's really important that you let them know that you will be there for them, and then just regularly checking in. Sometimes identifying some resources can be helpful as well. But the big thing is to legitimize the fact that you can see that there is something not right going on for them, and encouraging them through your support or through them seeking some other help, encouraging them to get the help. In my experience in mental health, while people wouldn't have chosen to have a mental illness, they often come out of it better than they went into it, because they have more awareness of their own strengths. They have more awareness of the importance of self-care, and an awareness of how important it is for us all to keep engaged with our families and our friends and our community. So I think, I'm hoping coming out of COVID that if we can stay positive, there will be some growth and change that we're all proud of.
Recognizing we're all under stress, talk to us about some ways we as individuals can cope with COVID.
In order to cope, I think we have to be healthy ourselves. And so I think self-care is really, really important. And a lot of people still have the sense that self-care is selfish. I always think about the analogy, if you're in an emergency situation on an airplane, the crew tell you, put on your mask first before you help your children, right? And I think it's the same thing during COVID. We have to put on our health mask before we can be sure that we can support our families and the other people that depend on us. And there's absolutely nothing selfish about it.
And finally, Linda, if you were to give us 3 takeaways to improve our mental health during COVID, what would they be?
I think I would say, first of all, remember this isn't forever, okay? Secondly, look after yourself so that you can look after others. And I think the other thing is to don't try to do things the way you've always done them. Be open to new ideas.
Thanks so much, Linda, for your time, your insight, and your thoughts on how to thrive, not just survive, living with COVID.
It was great talking to you.
Thank you so much for joining us today. We have a collection of online resources and a contact number if you would like to talk.